Mike Myers is not someone you'd want to meet in a dark alley. Or anywhere for that matter. But today, we'll have to put on a brave face because, do I have to say this? Dr. Myers will be here joining us in the classroom. He doesn't say much, but he definitely knows a thing or two about human anatomy and how to destroy it. Though the tools he uses to conduct his research are slightly more crude than what you might find in your typical laboratory. Now, if you're a fan of the Halloween movies, you know there are plenty of kills to choose from. So, Dr. Myers has handpicked scenes that will help us to learn a variety of structures and systems. Who knew? Horror pairs surprisingly well with lessons on human anatomy. Now, let's see how many of these patients I might be able to save. Interns, meet Cameron, a young man from the series 2021 installment Halloween Kills, who was about to have his night ruined. Now, I believe Dr. Myers started his bloody career in 1978, and somehow he's still out there doing what he loves. Tell us, Michael, do you ever get tired of it?
Cameron?
I guess not. Here, Dr. Myers uses his trusty chef's knife to demonstrate penetrating abdominal trauma, stabbing the point of the blade into the right side of Cameron's abdomen, and then again more towards the center. Approximately around the location of the belly button, or navel.
I just found something.
What?
This.
Several important organs reside within the abdomen, of which the large and small intestines and liver are most commonly affected by penetrating trauma. Both of Mike's attacks appear to be lower than the liver, which is almost entirely protected by the bottom portion of the rib cage on the right. However, Cameron will definitely suffer a gastrointestinal perforation to the cecum or the ascending colon, both parts of the large intestine, in the first blow, and the ileum, the lower part of the small intestine, with the second. These injuries require immediate medical attention as the contents of the intestines leak into the peritoneum, the membrane that lines the abdominal cavity, causing infection and inflammation. A surgical laparotomy will allow the surgeon to clean the peritoneum, determine the extent of the damage, and suture any lacerations that may be present. In Cameron's case, I wouldn't be surprised to find an injured appendix or ileocecal valve, and he'd definitely leave the hospital with antibiotics in hand. Were he to survive, a fully severed intestine could mean that there's a colostomy bag in Cameron's future. But wait, who am I kidding? An abdominal perforation of any kind with a non-prepped bowel, a bowel that has not been completely emptied of gastrointestinal contents, will result in an ostomy of some kind, at least until the evidence of infection has been eliminated and the internal injuries have completely healed. But Michael Myers is just getting warmed up, and Cameron won't have to worry about any of that. Then, in the spirit of love, Allison attempts to rescue her boyfriend from certain death. But guess what? The rescue doesn't go so well. She misses with a shotgun blast and then delivers 3 quick jabs with her own knife into Mike's abdomen. If he had any internal organs that weren't made out of demon flesh, he might be feeling some pain right now. But the attack doesn't faze him in the slightest. And then... he slams Allison's head into the banister and tosses her down a flight of stairs to a bone-crunching landing that takes her knee from here to here. Her left leg gets stuck awkwardly beneath the weight of her falling body, jetting into a queasy combination of extreme lateral flexion and external rotation. Her poor ligaments do not stand a chance against this type of hyperextension. The knee is a hinge joint, allowing the leg to extend and bend back and forth with minimal side-to-side motion. It consists of 4 bones and an extensive network of ligaments to help maintain normal function. In this particular case, Allison's medial collateral ligament, her anterior cruciate ligament, her posterior cruciate ligament, and the posteromedial complex of her knee are in particular danger. Not to mention the potential for injury to the popliteal artery as well. And she is obviously in a world of pain. And of course, Cameron is concerned, although to be honest, that should be the least of his worries. Calling out to his girlfriend and reminding Mike that he is still breathing. Pro tip: if you've been stabbed by an unkillable psychopath in a William Shatner mask, leave the knife in. As David Grubbs, an RN and paramedic with plenty of real-world experience, reminds us in a post on Quora, leave it in place. You will likely cause more bleeding when you remove it, as it helps to hold cut blood vessels closed. Excessive blood loss could easily expedite your death. However, if you're facing Michael Myers, you may not last long enough for that to matter anyway. Cameron tries to shoot Mike with a handgun, and Mike returns the favor by crushing his wrist. With enough force, it is possible to crush the bones of the wrist or forearm with a single blow. Your wrist is made up of 8 small bones, the carpal bones, plus 2 long bones in your forearm, the radius and the ulna. The smaller carpal bones are more susceptible to this kind of injury, since the bones of the forearm are more robust. But again, Cameron has other things to worry about. Michael proceeds to use Cameron's head as a battering ram and smashes through the fairly sturdy looking banister support beams. Definite concussion here. He then grabs him by the hair and pulls his head upward so that his cervical spine connects harshly with the banister railing. A 2007 study showed the most common sites of injury to include the atlantoaxial region, C1, C2, at the top where the spine connects to the skull, and the bottom 2 vertebrae or subaxial cervical spine, C6 to C7. But Mike, obviously unsatisfied with a couple of vertebrae fractures, he proceeds to slam Cameron around by his head and neck in various directions, as though he wants to break every vertebrae in Cameron's neck and crush the delicate spinal cord contained within. This series of attacks could easily kill Cameron, and as Mike saunters around to finish the job, Cameron can be heard wheezing. He is likely suffering from a crushing injury of the trachea, now partially obstructing his airway. I wouldn't be surprised to find vascular injury to the great vessels, carotids, or jugulars, or digestive tract involvement. If Cameron were to survive this encounter, he would probably be paralyzed for the rest of his life, having sustained various severe neck and blunt force trauma injuries, and lacerations including 3 flavors of whiplash in a matter of seconds. At the cervical level, this would likely result in quadriplegia, where all 4 limbs were paralyzed. Allison does her best to taunt Michael Myers into leaving him alone. It's just, Mike isn't one to leave a job undone.
Leave him alone! No! No! No!
Now, there is no coming back from that. The spinal cord has suffered catastrophic damage, and the great blood vessels are dissected. Or transected. You might be better off having your head cleanly decapitated. Okay, obviously not, but there are historical reports that recall severed heads showing signs of consciousness. When Jean-Paul Marat's killer, Charlotte Corday, was executed by guillotine in 1793, a man named François Legros allegedly lifted her head and slapped both cheeks.
What do you mean by that?
Onlookers claim that Corday's face took on an angry expression and her cheeks became flushed, which is a little bit implausible given that the head has been separated from the heart, which pumps blood around the body, including into the cheeks. But from Cameron, not so much as a wink. Don't you find this a little bit brutal, Mike? Maybe I'll just stick to medical insight. Our next patient is John Strode from Halloween 6, who, unlike Cameron, doesn't seem like a very nice guy.
Deborah, I'm home. Thanks for the dinner.
Abusive, belligerent, alcoholic. Commenting sarcastically on the absence of dinner.
I came home like I always do. And I said, honey, I'm home. Only there was no one there. No wife. No lights. No dinner.
No dinner?
He must not have realized he's a character in a horror film, where behavior like that rarely goes unpunished. But look, I'm not here to psychoanalyze John. I'm just here to comment on the particulars of his demise. In the ER, it's not our job to question how someone got there or ask whose fault it is. Ethically, it is our job to help them, no matter what.
Come out. Wherever you are. God damn it. She actually left.
John finds that his wife is not home and thinks maybe she's left him. And then the lights go out, and he hears suspicious sloshing and clanking sounds coming from the basement. I wonder what's gonna happen next. Dr. Myers is in the midst of another gruesome experiment, it seems. John opens the washing machine to find a cycle of bloody clothes. And of course, that's exactly when Michael Myers makes his move. First, a classic knife to the abdomen with such supernatural force that Dr. Myers lifts John clean off the ground.
It's this move right here. No one can do this.
As we've already discussed, this type of wound may involve any number of important organs, including small and large intestines, not to mention your muscles like your rectus abdomini and your external obliques. Although its exact function is unknown, the appendix, also located in the lower right part of the abdomen, underneath the ascending colon, hurts when damaged.
Seriously, what is it that you do?
If the sharp side of the knife is pointing down towards the ground in classic Mike Myers fashion, the initial penetration wounds caused by the stab will rip and tear as the dull side of the knife pulls upwards, causing unpredictable wound patterns that are particularly difficult to suture closed. And here, John's entire body weight is being lifted off the ground by a pointy spike. Go figure. It's possible that Mike is tilting the blade upwards at a 45-degree angle under John's bottom ribs, giving him a bony support as he flexes his arm to lift his victim off the ground. In this case, the liver, gallbladder, and possibly even the right kidney, if the knife penetrates deep enough, could sustain major injury. Side note, there are some impressive bicep curlers out there. Here's Doc Weber with a single rep at 135 pounds, and Cali Muscle casually pumping out 150 pounds. Can you say full range of motion? And while both of these are impressive, John likely weighs as much as 2 of these weights, and Dr. Myers is lifting that smoothly and with ease. Hey Mike, I was thinking, maybe you could take a break from this cold-blooded murder thing and enter some strongman competitions? Or just throw John up against the circuit panel and flip the breaker. Or was that a loose wire? It may be too dark to tell exactly what's going on, but with the water in the room to help conduct the raw electricity, John suffers a jolt with enough juice to start to fry him, quite literally. As the electricity courses through his body, John begins to expel a foaming liquid that looks more like Coke and Mentos than vomit. Foaming at the mouth can occur when someone is having a seizure and an excess of saliva mixes with air or gases to create a foam. The electricity causes muscles to spasm and forces air out of the lungs, sometimes causing a vocal noise even though the person may be completely in shock. The liquid inside John's body is also rising in temperature, so this foam is also likely very hot. Now, thespruce.com explains that most homes have an electrical service between 100 to 200 amps. But how exactly does electrical amperage kill you? Thankfully, Science ABC here on YouTube has us covered.
The amount of current flowing through a circuit is measured in amperes, or amps, whereas the potential difference between 2 points is measured in volts.
Think of water flowing through a pipe.
The water pressure is the voltage, which is expressed in volts, and the volume of water is the amperage, which is measured in amperes, or amps.
We're going to skip over the details here, but suffice it to say that
The real measure of a shock's severity lies in the amount of current, or the number of amps being forced through the body, not the voltage.
over on Reddit, Go helps fill in the blanks. A 10 milliamp current will most likely kill you through ventricular fibrillation, also known as an arrhythmia, wherein disorganized heart signal causes the lower heart chambers to twitch uselessly so that the heart cannot pump blood to the rest of the body. This would require direct flow into the heart via an electrode, for example. But Mike's approach is more crude and far more powerful.
But currents in the range of 100 to 200 milliamps could be very painful and even fatal.
Or as Go puts it, a 200 amp current through your body will char you and burn you from the inside out. At this amperage,
the muscular contractions are so severe that the heart is forcibly clamped shut during the shock.
And as electrical current passes through the human body, it heats the tissue along the length of the current flow, resulting in deep burns that often require major surgery and are permanently disabling. This mechanism occurs from the inside out, and as a result, the outward appearance of an electrical burn does not accurately predict the true extent of the injury, as internal tissues or organs may be much more severely burned than the skin. Wonderful. But hold on, if electrical current is passing through John, shouldn't it be passing through Mike as well? Maybe the MIT Department of Engineering can help us. This is the problem that people encounter if they touch live wires. Since we are almost always in contact with the ground, our bodies turn out to be excellent conductors of electricity, and the electrical current will happily use them to complete a closed path to flow from high potential, the wire, to low potential, the ground. Or in other words,
Simple yes would have sufficed.
yes, the electricity is flowing through the power source, through John and Michael, to the ground. If we add to the equation that both Mike and John are both wet, their resistance to the electrical current should be less and the shock more severe. Do we assume that Mike is an electrical whiz?
Being an electrician is really neat.
Who's somehow planned the attack, or just that demon flesh doesn't burn the same as human flesh? Somehow, Mike is able to withstand the electricity long enough to bake John all the way through, maybe 10 to 20 seconds, while he screams the entire time. And finally, yeah, I don't know about that. I've worked at hospitals for a very large part of my life, and I've never seen or heard about a human exploding due to electrical current passing through their body. Maybe someone with more electrical knowledge than myself can explain further down in the comments section.
Hey, you. This city property. No trespassing. What are you, deaf? Don't try that Halloween shit with me.
Next, we come to Dear Bucky, a power plant operator on the night shift. And unfortunately for him, this isn't just some kid playing a Halloween prank. This is much, much worse.
All right. I'm on the telephone to the police right now. Don't you even think about leaving.
Mike, I mean Dr. Myers' non-vocal approach to socializing is terrifying. He never dignifies anyone with response, but rather employs the most lethal nearby method to end their life. Here, he casually picks Bucky up pro wrestling style by his collar and belt and hurls him like a bag of trail mix right into the exposed power supply. Science ABC reminds us of the factors that determine how much damage an electrical current can do.
It's a combination of the volts, amps, frequency, and duration of current that deals a lethal blow to the body.
Compared to John, shouldn't this be more of everything? And if so, why doesn't Bucky's body explode? Can a body even explode due to electricity passing through it? Perhaps Paul Montgomery, a retired electrical engineer on Quora, can shed some light on this question. He explains, when lightning strikes animals or humans, its easiest path to the ground is along the surface of the skin. This produces burns. Things that explode when lightning strikes have a conductive path inside that contains moisture. The bolt heats up this moisture and nearly instantly turns it into steam. This steam expands, and since it is confined inside, it blows the item apart. On the Ask Science subreddit, Nihilist Friedery explains further. If you direct a lot of current, as in lightning, via a thick wire straight into the aorta and provide a good ground out of the femoral artery, maybe enough blood would flash to steam to blow open the chest cavity. I doubt it would happen otherwise. So, rewind to John. Maybe the metal knife in Mike's hand penetrated all the way through John's body, touching the power supply behind it. Perhaps we're expected to believe that the knife conducted the electricity through John's abdomen, causing the blood inside the main arteries to boil and turn to steam, causing an explosion. Or maybe we're just expected to enjoy the show. Alternatively, Bucky's skin is fried, as it is the portion of his body conducting the electricity towards the ground. In less severe cases, there is a chance that someone who gets zapped by electrical currents could be saved or revived, but the paramedic on scene would need to act quickly. So maybe we just don't play games around power equipment. In this scene, we find nurse Karen Bailey toweling off next to a hydrotherapy tub at the hospital where she works. These contraptions are great for patients who are doing rehabilitation therapy because of their calming effect on both mind and body. You know, like this. But unfortunately, that's not what happens here, even though Karen thinks it might be.
I'm sorry. Just have to get back, that's all.
For context, she'd just been amorous with a fellow hospital employee by the name of Bud Scarlatti. When she feels a gentle hand on her shoulder, she thinks Bud is back, even sucking on his probably very unsanitary fingers. Either Mike recently washed his hands or Karen suffers from agousia, which refers to the loss of sense of taste. But we'll never know, as our unlikely Casanova shows his true colors. As Mike dunks her head into the tub again and again, Karen panics and struggles to breathe. Her shock, combined with a random pattern of forced submersion, causes her to gasp for air erratically, taking water into her system, beginning the process of drowning. John R. Fledemeyer of Aquatics International explains the mechanism further. As water reaches the airway, the larynx usually closes, preventing water from reaching the lungs. The victim soon loses consciousness. The spasm then relaxes, allowing water to enter the lungs and disrupt the surfactant inside, causing the alveoli to collapse and prevent life-giving oxygen from being diffused into the tissues and from reaching the vital organs. And according to a 2018 investigation of drowning, a person can drown in 1 milliliter of fluid for every kilogram they weigh. So a person weighing about 140 pounds or 63.5 kilograms could drown after inhaling only a quarter cup of water. Be careful when you drink. Dr. Myers will not be satisfied by drowning alone, and he sets the hydrotherapy tub to a temperature that is not human friendly. And now Karen is drowning while being boiled alive. Take note. Third-degree burns will occur with a 6-second exposure to 140-degree Fahrenheit water, or a 30-second exposure to 130-degree Fahrenheit water. Even 120-degree Fahrenheit water can be dangerous over longer time frames. Interns, may I direct your eyes to the number on the dial? And still climbing. Scalding indeed. The skin is basically peeling off of Karen's face in a pattern somewhere between 2nd and 3rd degree burns. Stanford Health explains that 2nd degree burns involve the epidermis and part of the dermis layer of the skin. The burn site appears red, blistered, and may be swollen and painful. 3rd degree burns destroys the epidermis and dermis and may even damage the underlying bones, muscles, and tendons. Were it not for the drowning, Karen would definitely have a chance to recover from her burns, though she would carry scars for some time to come. There is a slim chance that if paramedics had arrived a few moments after injury, they could have done something for her. But the cumulative effect of shock, trauma, burns to the body and face, deprivation of oxygen, and the added indignity of being tossed onto the side of her head doesn't lend well to non-immediate treatment. You could argue that Dr. Myers was being overconfident here in assuming she's dead, but at the same time, he's probably developed a pretty good feel for these things by now. Now, What is it with Michael and nurses? Here we see a nurse by the name of Mary alone in a hallway, visibly shaken. There's a spike conspicuously sticking out of the wall. I'm sure that won't come into play at any point. Dr. Mike's patented one-handed person press, I should have guessed. Though a lift like this is far-fetched for an average person, he does it with ease, slowly and intentionally.
No one can do this, and science explains why.
As her feet leave the ground, the bones and tissues in her neck would begin to bear the brunt of her body weight, which they are not really designed to do. However, this position can be sustained by some people for a short period of time without lasting damage, if there is no sharp jerking or twisting motion. Some even claim that it decompresses the spine. Can you say shing ringer? Mary grasps at Mike's hand to alleviate some of the pressure on her neck. And for some reason, Mike isn't squeezing hard enough to suffocate her. Is he planning to choke slam her like they do in the WWE? Alas, no. Mary would be lucky to be slammed this way, even if it's onto cold, hard concrete. Sure, it could kill her by shattering the vertebrae in her cervical spine and or cracking her skull, but people have been known to live through landing flat on their back on pavement or concrete. And that's not what happens next. Looks like Mike drove the spike into the back of her head, somewhere around the first cervical vertebrae and the occipital bone, which is the only bone in your head that connects with your cervical spine, or the neck. The occipital bone surrounds a large opening known as the foramen magnum, an opening that allows key nerves and vascular structures passage between the brain and the spine, such as the spinal cord and the vertebral arteries, the anterior and posterior spinal arteries. Severing any of these structures is fatal, and since the murder weapon is a thick spike, she will have suffered fractures to whichever bone is struck first, possibly even dislocations as the thicker portion of the metal entered her body. Sounds particularly gruesome. Although Mary is still twitching, her death is a foregone conclusion. Her motor and brain functions will shut down immediately, and her eyes, open at the time these patterns ceased, will stay that way. Luckily, with her main nerve highway having sustained catastrophic damage, Mary won't feel any pain. But I know what you're thinking. What about Phineas Gage, who had a railroad spike get shot through his head in the 19th century while working on the railroad?
I promise I wasn't thinking that.
The guy featured in that great video on the Grunge YouTube channel. Did you catch that?
Explosives detonated early and sent the 4-foot, 13-pound tamping iron through his left cheek into his brain and out his skull.
By some accounts, he may not even have lost consciousness. While Gage suffered terrible brain damage to the prefrontal cortex, the railroad spike avoided the central brainstem region. After the accident, he was still able to function in society, though many who knew him reported a change in behavior.
He had become fitful, irreverent, indulging at times in the grossest profanity, and manifesting but little deference for his fellows.
So then, our prefrontal cortex must regulate our personality, while another portion of the brain regulates our autonomic functions such as breathing and digestion. With Gage's miraculous survival, many were inspired to formulate hypotheses about the brain, its functions, and the implications of these functions in the real world, ultimately leading us to deeper understanding. Over time, many accounts of people who've survived penetrating trauma to the skull have cropped up. Josh Brandom, a Quora user, recalls being shot in the head. I can tell you what it's like to get shot in the head 5 days later after you wake up from a medically induced coma. I would have to say the best way I can explain is, I guess it would be like getting hit in your head with a sledgehammer. As I'm typing this text, I'm still amazed by it all, and how I did not feel a bullet entering and exiting my head on top of blowing out my eye and breaking my bones in 40 places. But Mary won't be waking up from this. And obviously, Dr. Myers is dedicated to furthering the body of research available on patients with spikes to the head.
Oh, hell no! There's someone else down here!
Okay, a spike pickaxe hybrid. and after several crushing blows with the blunt end of his pseudo pickaxe, there probably isn't much left of the skull or the brain. And then Mike walks onto the porch like nothing ever happened. It's just like another day in the office. Okay, you know what? I need to make a statement that as a doctor who tries to save people, I'm not going to give Michael Myers even more exposure by talking about all of the evil stuff that he does.
That's a bold statement.
I cannot condone it. I'm out of here. Oh, God. All right. It appears that I've had a change of heart. Dr. Mike has requested we end with a pop quiz, and I am inspired to oblige him. How long can a person survive after they've been cut in half by a circular saw? Our guest professor has requested your answer in the comments down below. Is it okay? Can I go now? If you liked the video, be sure to subscribe. And if you didn't, let me know why in the comment section down below. As always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, and teach one. Oh yes, and Dr. Mike Myers.